I grew up as the second oldest of 11 kids, and growing up in a large household taught me many important lessons. When I was 12 years old, my dad, for instance, took me to Mexico to provide humanitarian care for people there. And for a week, we treated patients from morning until the evening, and we just treated as many patients as we could. That, for me, was an amazing experience. I got to treat patients. A lot of them had been in pain for who knows how long, and were finally able to get relief that they had been looking for a long time. That's the reason that we pursue a career in the healthcare field, is to help other people. In college, I got married to my sweetheart, my wife Heidi, and we had our first two children in undergraduate school at Arizona State University. By the time I was there at Arizona State, I knew I wanted to go into healthcare, and I really dedicated myself to my studies. By the end of my time there at ASU, I had identified that I really wanted to go into dentistry, and not only dentistry, but specifically into oral surgery. That was my goal at that point. So I applied to dental school, and I got in at the Arthur A. Dugoni School of Dentistry at the University of the Pacific, which was an honor and a real privilege for me to work there with some very good clinicians, and I got fantastic training while I was there. While I was in dental school, I did very well. Was able to apply to oral and maxillofacial surgery programs, and was matched at the Yale New Haven Hospital for oral and maxillofacial surgery. At that time, my wife and I had our fourth child, and we started the journey in Connecticut, where for the next 4 years, I was heavily involved in the world of oral and maxillofacial surgery. After I finished and graduated there from Yale New Haven Hospital, we moved back to Arizona, where we were able to come live close to grandparents and cousins, and my wife and kids have loved every minute of being close to family. That has been a highlight in my life and in theirs. Practicing oral surgery with my dad and brother, and also in practicing oral surgery with other doctors in the community. That has been an awesome opportunity for me. My goal now is to create a practice, and using a blend of expertise and people and education, we want to provide a place and a setting for patients to come and to receive treatment where they can feel comfortable, and where they can receive treatment that maybe they were afraid to go seek out. We hope that patients who have had anxieties and who have been unable to undergo treatment will be able to feel comfortable with us.